The most recent state-by-state report from America's Health Rankings places Arkansas 49th when it comes to overall children and women's health, and Mississippi 48th. Mississippi's ranking rose from 50th in the last 2 years. Arkansas's remained steady at 49. Both states have struggled with health access and information for years, if not decades. The nonprofit Teen Health Mississippi is geared toward improving health and health conversations for people in that state, and is now doing the same here with Teen Health Arkansas. Hope Crenshaw, Ph.D., Executive Director of Teen Health Mississippi and Teen Health Arkansas, says a major component is to provide information and resources for young people to protect their health.
And not just young people themselves, but the parents in their lives and the guardians, trusted adults in their lives, because what we know is that it's the parent-child connection or the parent-adult, trusted adult connection that really pushes youth health outcomes forward in positive, proactive ways. And that's what all the research shows. And that's what we're actually seeing on the ground.
First steps in Arkansas include teen talk sessions. The first were in Eudora, Brinkley, and the very first was at New Bethel Church in West Memphis. Ursula Weems, a member of that church, says her pastor heard about the sessions and thought they should host one.
When you think about the church, growing up, you didn't talk about being protected about sex in the church. You didn't talk about mental health in the church, but it made us question, why not? Why aren't we talking about this at the church? You know, the church is supposed to be the place you come for healing and to be saved and stuff. So why not talk about this with our youth? And why not, as parents in the church, say, hey, we don't know this, but let's get us somebody who can.
Ursula says she didn't realize she would be asked to help facilitate the session that night. That would include some uncomfortable conversations about sexual reproduction, mental health, and general well-being. She says she wondered, why me?
Then I thought about what stuff that I did, like as a teen, like being raised in a Baptist church in the country, how my life could have been different had I had this information. And now I finally got the answer to the question I've been asking for the last 2 years. Why me? Because I went through some things, and I know had I had this information back then, it could have changed some perspective and what I did, growing up. Not saying it was bad, but, I didn't sign up to be a teen mom. I didn't sign up for the sexual abuse, the mental health, but it's all a part of my story. And, having the resources and things, to tackle those tough things would have made a difference.
Who better, she says, to tell and listen to stories surrounding these matters than those with lived experience. Hope Crenshaw, Executive Director of the Teen Health Organizations, says these sessions are constructed to have youth and adults as co-collaborators and do not treat young people as part of the problem. Teens are voting members of the boards of directors, and adults are given information to empower them to have discussions, even if awkward, about issues regarding teen health.
Tough talks, but tough talks with confidence and with factual, medically accurate information to make sure that we can push health forward.
She says adults and teens can learn together that misconceptions, misunderstandings, and misbeliefs are often shared, and that lack of access to information can be intergenerational, as can be the desire for knowledge.
So you had grandparents at the table, you had parents, you had young people at the table, and the parents would say, yes, this is what my parents taught me. My parents taught me that you should always keep like a quarter or an aspirin between your knees, right? Because that way, nothing gets in, nothing comes out, you don't get pregnant. And we saw grandparents say that was because that was all that we knew at the time. But now that there is more information and more resources available, our young people, my grandchildren, actually need this information, and you need this information, and I need this information. I wish I had this information. And so what we're building here are community conversations grounded in trust.
Teen Health Arkansas is concerned with young people's general well-being. That could be sexual reproductive health, relationship health, mental health, or just knowing how to talk to your doctor about myriad topics. Hope Crenshaw says it's really about giving more people agency, young people agency to seek information about their own health, and adults confidence to talk to young people. She says the more people with agency, the better the state. Facilitators are provided training for handling these sessions, and Ursula Weems, who helped facilitate that first session in West Memphis, says this might represent a tone shift in conversations, but trust and honesty matter.
We're not going to agree. We might frown a little bit, but we're not going to throw you out. So honesty. So we'd rather for you to be totally honest with us than go to Facebook and get information that's incorrect. So
I love what Ursula said. One of the pieces in the adult piece of that is we talk about open and closed communications and the difference between saying you better not be having sex to the conversation of like, if you decide that this is what you want to do, please come to me so we can get the resources that you need. My value is that I want you to remain abstinent until marriage. However, right, there's a difference in that language, in that communication, so that when young people come to adults, they're not met with closed off language. They're met with that open language.
Lifting two states that have traditionally been among the very lowest when it comes to health rankings will take work, but
if we don't do it, who will? If everybody have that same mindset, it's never going to change, or we're never going to change. Okay, you prove them wrong. Be the change they say can happen. So if we don't do it, who's going to do it?
The work of Teen Health Arkansas is extending beyond these Teen Talk sessions, though there will be more of those. There will also be workforce development sessions to improve communication between young people and employers, a mental health first aid series for both young people and adults, and Hope Crenshaw says there will be one-day micro-mobilizing youth summits to foster advocacy.
In Mississippi, our young people are working on legislation. They're writing legislation. They just got something through the House on violence reform, and it is in the Senate right now. We want to bring that same energy to Arkansas and have young people be at the forefront of change. So we're teaching them how to advocate at the school district level, how to advocate at the community level, ultimately at the state level as well.
Ursula Weems says the first steps, these Teen Talk sessions, are an encouraging opening to a path forward for health and for greater community. She says having a session at New Bethel Church in West Memphis was very important.
We're located in that area where people say, hey, I'm not going to go to that area, especially at night. Oh, I'm going to lock my doors. You know, like you said, I'm just not going to go to that area. So, but when we're in that area, I see people that look like me. I see people that have similar stories to me. I see people, and when I say people, I'm not just talking about African American. I see people like their situations, the same situations I grew up in. I see people that want help but don't know where to go to for the help and where to ask or how to ask. Sometimes the question don't get asked because we don't know how to ask the questions. So for me, what I said earlier, if we don't do it, who will? Because I see the young ladies who deal with life issues. I see the young men that have been counted out. I see the ones that's feeling like that don't nobody care, because if they care, why aren't they here? If they care, why aren't they showing up for us? They show up when we do bad stuff, but why aren't they showing up to help? So I see that, yeah, it's a rough neighborhood, but everybody deserves the same resources. Everybody deserves the same connections.
More information about Teen Talk Arkansas can be found at teenhealthar.org.